last night, and you definitely want to see the video. It'll be up on our Studio 10 page in just a bit.
October is Breast Cancer Awareness Month, and that means, ladies, it's time to get your mammograms. And today with me, Dr. Lauren Self from Springhill Medical, and we're going to talk about mammograms today, and a lot of people that have never had them, and I know I am one myself. What is a mammogram exactly?
Sure. Well, mammograms are designed to look for breast cancer in patients who have lumps that aren't able to be felt by exam or a self-breast exam at home. And usually we recommend that patients start getting mammograms at age 40, and they will get them every 1 to 2 years from age 40 to 50. And then above 50, we recommend every year. And there were recently new guidelines that were sent out by the U.S. Preventative Services Task Force that says that we can start at age 50. However, most OBGYNs prefer to go with the American College of Obstetrics and Gynecology recommendations, which were like I described earlier. So usually around 40. Now, if patients have more risk factors and they have tested positive for genetic mutations that increase your risk for breast cancer, then we would obviously start screening earlier and more frequently. But for the average American woman, it would be at age 40.
What are the risk factors that you were just talking about? I mean, would that be if someone in your family has had breast cancer?
Absolutely. That's a great question. So the big things I tell patients are, when you are thinking about your risk factors for breast cancer, age is the biggest one. The older you are, the higher your risk. And women up to age 80, their lifetime risk of developing breast cancer is about 1 in 8 women. So it's very high, and that's even higher, like I said, if you have the genetic mutation, which we can test for through a blood sample. Another one is family inheritance. So if you have 2 or more close relatives, like first-degree relatives, mothers, sisters, that have breast cancer, certainly you would want to talk to your doctor about possibly getting tested for the genetic mutation or starting screening earlier. And so you'd want to know your family history as well.
Okay, now for someone who maybe hasn't had a mammogram, it just kind of sounds scary. What is a mammogram like? What can we expect?
Sure. The things that I tell patients are, you usually want to schedule your mammogram about a week after your period starts. That's when your breasts are the least tender, and it's also when your hormones will have the least amount of effect of changes on your breast. You also want to tell your technician, obviously, if you have breast implants, they may want to get different views or be a little bit more gentle as to not pop it. Also, moles and scars and things like that, they may want to cover up so they don't affect the results. And then the last thing is, you want to be careful about deodorants and creams and powders and things that you put on beforehand. You want to not have those, because they can also affect the results. When you go in, they put your breast between 2 plates. They're plastic or metal, and then there's a low-dose beam of radiation that goes through the breast that takes a picture that the radiologist will look at to see if they see any calcifications or abnormalities. And usually it takes about 10 to 15 minutes. I think the longest part is positioning the breast correctly, and then the picture is very quick.
How often do you need to have a mammogram?
Well, I think you should discuss it with your doctor. Between the ages of 40 and 50, depending on your risk factors, it's usually every 1 to 2 years. And then from 50 on, it's every year.
All right, so a lot of very useful information.
Yes.
Thank you so much for coming in and sharing with us.
Absolutely.
And if there's more information that you would like, you know how to get it. All you have to do is click on the Studio 10 tab on fox10tv.com. Thank you again.
Thanks.
Thanks, Chair. Some very